Hi, everyone. Welcome. We are going live from Vancouver. As you can see, it's a gorgeous day behind me. It's just after lunchtime. We're going to be having a very interesting discussion today around laser and how the many different types and modalities of laser can be used to both treat the skin and also help you age gracefully. So just hang tight. We're going to wait for a few more people to join and then we'll get started. Hi, everyone, and welcome. My name is Angie Buonasisi, and I'm the co-founder of 8 West Cosmetic Surgery and Laser Skin Clinic here in Vancouver. 8 West Clinic was founded by myself and my husband, facial plastic surgeon, Dr. Thomas Buonasisi, in practice for over 20 years. And what we really do very special here is we offer a very comprehensive combination approach to rejuvenating the skin. Some patients choose to try lasers and different types of devices with increasing degrees of invasiveness, if you will, while others will opt for surgery. And we have an amazing team of treatment providers that really work together to customize treatment plans for each patient. Nothing is off the menu a la carte here. I'd like to introduce you to somebody very special at our clinic. Her name is Suzanne Power. Suzanne, hi there. Suzanne has been with us for, hi Suzanne, welcome.
Hi, thank you.
Good friend and very skilled, expertly trained and very experienced skin specialist. Suzanne comes from Ireland. She's been with us for going on 7 years now, and she's specialized in skin treatments using many different types of lasers and devices for over 15 years now. So welcome, Suzanne. It's fantastic to have you here today.
Thank you. So happy to be speaking today. This is one of my first live shows, so bear with me, everybody. So yeah, no, I'm delighted to be working with such an amazing team of experts here between, Dr. Buonasisi and our nurse injectors and our incredible team behind the scenes. I really have to say their expertise and their dedication to their clients and their passion that they put into the results is it's really inspiring. And I suppose that's really what kind of makes the team here at 8 West really, really special. So I'm really, really happy for today. Excited.
Thank you, Suzanne. It's so wonderful to have you. And yes, this is a very special place. We've got an amazing team, and in addition to being very good at what we do, we also have a lot of fun, and it's a really wonderful place to be. So today we're talking about laser, and we're going to get into laser in just a moment, but I did want to say, very exciting, at the end we'll be sharing the details for how anybody that saw the event today can redeem a $50 gift card for our clinic. We really recommend that you use that, book a complimentary consultation, come in and have Suzanne or one of the other experts at our clinic assess your skin and come up with a plan for you that is customized depending on your objectives, your tolerance for downtime, the specifics of your skin that our experts will learn about you. Also very exciting is we're going to be giving away a $1,500 package to somebody that attended today, and you can use that towards possibly towards a series of hero BBL treatments. We're going to talk about that in a minute today, or if hero's not right for your skin, it'll be something else, but that's going to be a great way to get started on your skin goals. So let's jump right into the topic. Suzanne, I was wondering if you could start off by talking to us about the skin. How does the skin age?
Yeah, of course. And one of the reasons why I'm really excited about talking today is that I find a lot of people that I come across end up doing treatments and they don't really know why. They're not given the education. So that's kind of what I wanted to bring today. So starting off, I suppose we do start to see the first signs of aging beginning as, little fine lines. They do begin to become a bit deeper. They stay around whenever our skin isn't moving. We start to lose a bit of volume in the cheek area. I actually think I have a bit of a visual that I can bring up right now that I can actually show. But generally when we start out on aging, we start with incredibly healthy skin. We've got so much hyaluronic acid and collagen, and our skin is taut and it's glowing, it's healthy, it's functioning. And when we come into late 20s, 30s, it's different for everyone, but we start to see those fine lines creeping in. Texture starts to appear a tiny bit rough, maybe some dull, tired skin, and maybe a bit of volume loss. And people can sometimes see this, starting around the eye area. They might feel that they're just really tired. And deepening nasal folds, which are those lines kind of around the nose, around the chin, and then further progressing into kind of those deeper lines and wrinkles, and then starting on laxity, and just the skin starts to move a bit more and kind of settles around the jawline. So it is such a gradual process. We call this intrinsic aging. This is our genetic journey, to getting older. And it is going to be different for everyone. So everybody displays different conditions and characteristics. And, so that's why whenever somebody comes into me, it's about, let's see what exactly, my client is concerned about and what we see, because often, I suppose people don't even know what they're looking at. That is not their job. Things manifest extremely slowly. And so that's why it's really important, to have a consultation and we can, point out these little things that they're seeing. So that's kind of the main process of the aging. And then we have extrinsic aging that we can come to a bit more later on in the show. But extrinsic aging is something that's going to accelerate this whole aging process. And this is the environment. And I'm sure everybody has heard all about this, but UV damage definitely contributes to the most of premature aging. But you've also got other factors like stress, late nights, not getting enough sleep, what we put inside our body. There's so many different factors. It's everything that's just stressing us from the environment. And that is accelerating this whole aging process. But this is something that we can reverse. This is something that we can slow down. And so I know people say, oh, well, I'm aging and I can't do anything about it. Well, true, but there's a lot of the aging that you can do something about it. And that's what we're here to talk about today.
Yeah, so interesting, Suzanne. And you are such an expert here. And I just want to point out that we could literally spend 5 days giving an introduction to laser. We're really trying to cram a lot of information into one.
How many people I talk way too much?
No, you are fantastic. We're trying to condense it and keep it and present the high points. But what I do want to say is that there are many different types of lasers, many types of devices, many types of objectives. Sometimes we're trying to prevent, sometimes we're trying to maintain, sometimes we're trying to correct. And what I thought you could do, Suzanne, is give us a bit of an overview of the broad types of technology out of there. Could you start by talking to us, telling us the difference between ablative and non-ablative and full field and fractionated?
Yeah, of course. So there's two types of lasers. There's non-ablative and ablative. So non-ablative is something that we call a coagulating laser. It doesn't burn the skin. We can position that laser beam into any depth. And what we're doing is it's attracted to the water and we're just building heat in that tissue. When we do that, we are creating a controlled injury, which is inflammation within the skin, and your body just wants to heal that immediately. So it sends a cell called a fibroblast, you may have heard of this, but rushes to the area, stimulates more collagen elastin to strengthen, so thus producing more collagen and redensifying. Ablative, on the other hand, we are removing areas of tissue. So think about resurfacing, think about smoothing, think about acne scars. So that's where generally laser fields fall into these two categories. So non-ablative, just coagulating, creating collagen, doesn't burn the skin. It's just heating. And then ablative is removing. And so then you talked about fractionated and full field. So often I start throwing these names out through a consultation and people are like, what are you talking about? So full field, what we try and describe is as we're removing 100% of the surface area that we're treating. So our TRL, micropeel, nanopeel. Fractionated was when they realized that they could take one laser beam and divide it into fractions. And the beauty about this is that we're leaving healthy tissue surrounding each one of these wound injury points. So spurring your skin to recover faster, lower downtime, people can get back to work. But with that, we do more treatments because we're only treating a fraction of the skin if you think about it that way. Yeah.
Exactly. That was so well explained. Thank you. And I think that's really where the power of a consultation comes into play. Some patients will want to, for example, some of our patients that might be having facial rejuvenation surgery, they may decide that's a good time to have a more aggressive treatment and really sort of remove and buff down literally wrinkles around the mouth and eyes. Some patients might say, I just don't have enough downtime. I can't take 2 weeks off work to recover, but I could do a series of treatments that are going to slowly build up to something. So really recommend you start with a consultation. Catherine, I see your question. Thank you. It's a great one. And we'll take some Q&A at the end here. So Suzanne, let's now talk about, why don't we talk about the different modalities that we have at the clinic here, focusing on the Cyton platforms. And maybe, does it make sense to start with least invasive and work our way up to most invasive?
Yeah.
What do you think?
Yeah, let's start with that. We'll pull a couple of my favorite devices. So let's start with BBL. I think everybody knows BBL, broadband light. So we are using this device. It's a light-based device, and it's attracted to pigment, and it sees blood vessels, and it also sees water in the skin, which will stimulate a bit of collagen. But its main thing is really to kind of pull pigment out of the skin and coagulate some blood vessels. But with the power of BBL, which is the Cyton platform, which is one of the most incredible IPL, BBL devices I've worked with, is the fact that I can pull on any one of these filters. Like, you know, so this kind of means like I've got 8 different hand pieces hanging in my room, and I can flick between any one of these during one of your treatments. Whereas, you know, older IPL machines don't give you that advantage. So you can see at the start, this is a very superficial blue light. It kills acne P bacteria, so it's included in the Forever Clear treatment. You know, then we go down into pigment and vascular. I mean, then we can go into deeper layers for darker skin patients that still need to treat some pigments, which is a fantastic new thing with BBL that we can do. But then we can take that energy and we can extend the wavelength, plunge into that dermis, into the mid-dermis, and create this denaturation and more collagen. So this is our skin tight treatment. So this is targeting kind of deeper layers of the dermis to tighten laxity, great for around the neck, and generally kind of felt like having no downtime. So this is something that you can come in, you can leave, you might be a bit blotchy, and back to work and doing your thing the next day. And great combination treatment as well. So often I throw this in on other treatments, and because this is all working on the superficial layers of the skin. Okay, so I suppose going forward, I might as well just jump right into it. One of my favorite treatments in the clinic, Halo. So Halo is kind of like what I'd like to describe as like your trusty pair of jeans. Whenever you're not feeling good, you pull them on and you feel great. This one just is fantastic. It delivers results every time. And one of the reasons behind this is that it's using 2 different lasers in synergy together. So if you can see the little blue columns that come in between in that dermis area, that is that non-ablative laser that I was talking about. That's the one that is coagulating and creating collagen. So when we do that, we are creating strength and more volume and redensifying that dermis. So plumping out pores, fine lines. It actually is a nice area where that deeper pigmentation is lying as well. So great for melasma. And the other little white little columns at the surface is demonstrating the ablative resurfacing. So great for smoothing out the superficial layer, superficial pigmentation, and when you smooth something out, you get this amazing radiance, reflectivity, light just bounces off your skin, and I suppose that's why they call it a halo glow. But when we kind of go through things later on, I think you'll see the results of that. But by far, probably one of my favorite treatments, and because you're getting that dual action result, like you're working on your dermis and you're working on your epidermis. And one of the most amazing things about this treatment is that it's so tunable. So both lasers, I can dial it up and dial it down. I can do different areas of the face in different settings. So totally customizable to anybody. And then going on, am I giving you a chance to speak, Angie?
I'm just running with it, and this is fantastic. Go for it.
Perfect. Okay, so from Halo, so this is taking resurfacing a bit deeper. So Pro Fractional is our new favorite toy. Well, not so new, but and we've been wanting this for so long. We've had basically so much time to kind of now do our combination treatments and really see what amazing results this treatment can deliver. But when you see these columns going down, so this is that ablative channels that I was talking about earlier. Look how deep they go. They can go all the way down to where that non-ablative approach was with Halo. So if we want to intensify that resurfacing component of Halo, we're just putting Pro Fractional right on top of that. We can, just focus on areas of, deeper lines and wrinkles. And again, remember I said that fractionated, that means less downtime than the full field. But this treatment, amazing for acne scars, amazing for surgical scars, amazing for those deeper lines and wrinkles, deeper pores. So really getting into the more kind of aggressive resurfacing component. But remember, it's still fractionated, so still the downtime is still pretty easy. And we do have the option, and this is why Pro Fractional is so amazing. We have the option to take in a coagulation method. So you can see on the right-hand side, this column, and it kind of looks like a bit like a matchstick, which it kind of is, because I can turn up the end of that match and turn it down. And what that does, it deposits areas of heat, which allows your skin, your collagen to contract, your dermis to contract, and that whole regeneration process is creating more collagen. So getting into those deeper scars, deeper lines, so deeper texture, I suppose. So just very customizable. And what I love about Cyton and their devices is the fact of how tunable they are. So, depending on what my client wants, I can dial it up, dial it down.
Fantastic. And do you want to finish off with the TRL?
Yeah, let's go into it. Okay, so this is full field resurfacing. So full field resurfacing just means that we're moving 100% off that surface area. So wherever I put that beam of energy, I am removing skin. And extremely precise. Now you see 3 different channels here. So it is totally customizable. That you see on the right-hand side, nano peel. Okay, this is like an aggressive microdermabrasion. We precisely remove that top layer of your stratum corneum. It's very, very thin, almost like the side thickness of a bit of paper. The micro peel. Okay, so now we're delving a bit deeper. We're looking for those kind of like deeper lines and wrinkles, maybe some deeper pigmentation, and we still want to do that full field exfoliation. Then we go into the TRL, which you see as deeper surfacing, and this is one of my favorite tools, only just because it just creates the most amazing results. And sometimes when people come in and they lines and wrinkles are really bothering them around their eyes, maybe around their mouth, especially for women as we age, we do start to see that texture. And our skin might be great and amazing collagen everywhere else, but we just have these telltale signs like of aging. And just by smoothing and resurfacing in one treatment, like we really can really buff down lines and wrinkles. Like the results are incredible, actually. So that's all of my favorite lasers at the moment together. And the most amazing thing, I suppose, is that I've used all of these in one treatment. And that's because they're hitting different depths of the skin. And I think that's really important, that the fact that the people that work here, my colleagues and Sonia, when we are choosing your lasers to put together, like, we are highly knowledgeable about the anatomy of the skin and where we are depositing that energy. So, if you're ready and you're a suitable candidate for that type of treatment, we can put together that treatment plan for you. Other people maybe want to start a bit slower, and we can do that also. And that's again like really what is discussed in the consultation. And going on your downtime, what have you done previously? So yeah, it's all about expectations.
That is so interesting. I absolutely love these devices as well. And I think it's a great story that what Suzanne it's sort of typical is that our treatment plans change over time. And so Suzanne's been treating my skin for 7 years now. And I started with, lighter treatments like a halo, for example. And I absolutely love the halo. I do it once or twice per year because it really clears up the visible sun damage, the pigment that I pick up during the summer when I do all of my sports. I'm so careful with sunscreen, but when you're bike riding, you just can't. I'm not there. So the halo is amazing for clearing up my pigment, and over time I can see it plumping and improving as the months go on. But what we did very recently, which was because I've aged a bit more and the wrinkles around my eyes are a bit deeper, is we did halo and then layered that with some profractional. So profractional around my eyes and around my mouth. And I really liked the result of that. And I'm at the point now where I need to go a little heavier if I want to see a little bit more of a result. But I just want to talk quickly about the combination approach. The other thing is I am going to continue to squeeze and create that wrinkle around my eye, which is going to continue to encourage those deeper wrinkles to grow. So a light touch of Botox or Dysport around the eye softens those wrinkles and they'll develop more slowly. And so it really is that combination. Sometimes we're combining not only lasers, but lasers and other treatments as well.
Yeah,
so
absolutely. Sorry, go ahead.
No, that was all I wanted to say. Just also that I'm so happy with everything that you do for my skin. Thank you. So let's talk about treatment timeline. So typically, how long does it take to see the results of a laser treatment?
Yeah, so, definitely the different lasers that I talked about have different time frames. So, doing a BBL, we are lifting pigmentation, it's superficial, we are coagulating blood vessels. You're going to see that pretty quick within 5 to 7 days. You're going to see that pigmentation lifting and clearing. It is only superficial pigmentation, and we do require, a number of treatments, and they are normally spaced about 3 to 4 weeks apart. But typically when you're working with collagen, like this is, people sometimes think that, well, I've done the treatment, I've done the hard work, I've done the downtime. Okay, where's my results? And, we have to understand that look at where I was placing that controlled injury. It's deep down in the layers of the dermis. And technically we are, actually causing a collagen type 3 immediately. And it takes almost anything up to 2 weeks for that to change into collagen 1, which is the most abundant collagen found in the skin. So we have to go through that inflammation process, and then we have to create a lot of collagen to come up and be visible on the surface. That can take 8 weeks, if not sometimes longer. Like Angie, like you mentioned about you having your treatment, I did that Halo and ProFrac on my lower part of my face, and I did around my eyes, and that was mid-March. I feel like I'm starting to see my best skin now. Like I don't have to wear much makeup. My skin glows. Everybody's like, what are you doing to your skin? I'm like, well, nothing. I'm dying for fall to get my next treatment. But oh yeah, I did. And I always have to remind myself, it does take that long. Anything from 2 months onwards to really see, results from collagen. And it depends on how aggressive you're being as well. So if you're taking something slow, you're creating a certain amount of collagen. And then you have to do, another treatment to create another little bit of collagen. It depends what your starting point is, which is very important as well. So, so it does take time. And I think that's why it's very important to, when you're having your consultation, think about, is there a time frame that you're wanting, to have these treatments done by? And kind of schedule accordingly, because, I definitely find coming up to the summertime, I had a lot of consultations. They were getting married towards the end of the summer, and they wanted these treatments for lines, texture, pore size. And unfortunately, we couldn't really do something within their time frame that they would notice the benefit without doing a chemical peel or, BBL, so that's why I feel it's incredibly important to get that consultation and just to get your information. Yeah,
absolutely. The patients that do the best with their skin are the ones that have sort of an annual plan for their skin, which we help you with. But it really ensures that you get all the treatments that you're hoping for in scheduling around holidays and limitations, etc. Suzanne, we have had you in so many amazing results. The before and after photos are incredible. I really want everybody to see them. Let's get started on those.
Okay, very exciting. That's my favorite part. Okay. So who are we bringing up first? Are we going to bring up Ash? I'll just
let's see who goes up. Who's Mitch going to put up there? Hey, Mitch. I love the reel that Mitch made for the beginning. The video with the music, that was gorgeous, Mitch.
Yeah,
thank you.
Pretty good.
Yeah.
Okay. So by far one of my favorites before and afters. So this incredible lady came to us. She really wanted something done with her skin. She hadn't really noticed the certain changes that had been developing. And, then she looked and she said, right, okay, I have to go and talk to somebody. So originally she actually went to Dr. Buenasisi and she was considering doing surgery. And one of the things is that Dr. Buenasisi actually felt that she could get better results from laser treatments and possible collaboration with injectables. So when you look at this person here, we did a combination approach. I did a halo for her face. Then I went in, I did TRL around her eyes. And this is the full field resurfacing. I did TRL around her mouth. So look at that texture change. And look how much it's actually improved, like even the nasolabial folds. And underneath the eyes, totally plumped them up. But then I did a micro peel, full face, just to resurface everything. On the day, actually, I decided to throw a BBL in there. So there was a bit of, you can see the superficial pigmentation. So it's like, I can't do all of that. I just need a bit of pigmentation. So we were left with this amazing result. However, there was still that bit of volume loss in the cheek that I could not correct with laser. So that is where Lisa came in and this most amazing little bit of volume in the cheek just with a bit of filler. And like, just look how much that just plumped everything out. So yeah, I'm so ecstatic for this lady. She's incredibly happy and her results are still going. Like, she's only 10 weeks after her treatment. So your best results are seen up to 6 months afterwards. So yeah,
That's an
incredible.
amazing case study and beautiful result. And I'm so thrilled for her, and I know she's very happy, and she's an extremely lovely patient as well. Let's now, okay, who do we have next, Mitch? I think we might have, let's see who it is. By the way, any photos that we do show are done with the patient's express permission and consent.
Absolutely. Okay, so this client, she actually began very nervous and dubious about doing laser treatments. We started her off in BBL, and so she did some of BBL treatments, and then she just, after she developed that trust, she just said, right, let's just do it. So I did a halo and a profractional combination for her. So halo, we did a deeper density, and then profractional, I went full face over just because she had a bit more texture, a bit of the deeper lines and deeper wrinkles and texture. But look at that volume that she's reclaimed. Like, it's incredible. Like, again, that was one treatment. So, and she just looks so much more youthful. Look at the nasolabial fold and the little bit of jowling going on. That just is lifted completely. So yeah, just
not to mention, as Bella is pointing out, the glow in her skin. It sort of looks like youthful toddler skin again.
Totally, absolutely. And she had no injectables, nothing. That was just purely laser treatment. So, but look at her cheeks. They look really good.
Wow, yeah. That's great. Wonderful. Yeah. Well done. Okay, let's take a look at the next one.
Okay. Which one are we coming?
I'm going to be sharing, Suzanne, I'm going to be sharing the link very soon so that the participants can go and find their instructions for claiming their $50 gift card and for making sure that they're in the draw for the $1,500 treatment plan. Okay, Suzanne, who's this?
Yeah, so this guy originally came in for acne scarring, especially around the temple area and just on the upper cheek. We did halo treatments. We did actually 2 treatments at this point, but look at the improvement of the scarring. And these are the hardest scars on the temple where we lose that bit of volume. These are box scars, ice pick scars. But I want you to look at like how fresh and how bright his skin looks. Like, he was not expecting that. He just looks altogether healthier. His skin is vibrant. And again, guys, this is this halo glow I'm talking about. But again, look at the cheek area. Like, if you can see in this before photo, you can see this line coming down from the inner corner of his eye. And then all of a sudden, plumped out. And that's what I find with halo. It just plumps up the cheek area and kind of just gives that bit of a lifting, because this is where we lose that little bit of volume. And yeah, I again, love halo.
Yeah, fantastic. And I guess, do we have an acne scar before and after, or not in this one?
Not in this one. I was thinking we might need a whole other live show for that.
A whole other live show, because we do also, with the fractional device, can also be used to further improve acne scars, and we're seeing amazing results with that. So Halo provides a subtle improvement, an excellent change and improvement to the glow and the tone and the texture of the skin. But going over that with the Pro Fractional will really, it's like the gold standard treatment for acne scars. Yeah. What do we have next, Mitch, for before and after photos? We're going to be trying to get everybody back from their lunch live stream here very, very soon. We're just going to wrap up a couple before and after photos, and then we're going to share the link for your gift card.
So this is a long-term client of mine. We did, a halo, some BBLs, and what we were starting to find was like that we were maybe plateauing a bit, and we realized we had to take it one step further. So what we look at here, look at the texture. So guys, this is a profractional full face with coagulation. This is stimulating collagen. This is removing the upper layers of the skin. We also did a bit of a halo underneath just to kind of get extra coagulation in another area. But look how bright she looks. We also did TRL on her upper lip as well. So we did the combination halo, pro-fractional, TRL around the mouth. But she just, like, look at the pore size is just completely minimized. Around the sides of the mouth, which is like where we always see it, that is just totally lifted. It's smooth. Like, I just absolutely love her results. She was blown away with her results whenever she came in and she saw it. And this is going, her treatment that you see, she'd done some treatments beforehand, but this just took it to a whole different level. And then she also does maintenance BBL treatment. So this is going on years in the difference. And like, she looks like she's going back in time. It's great.
Oh, wow. Yeah, I can see that for sure. Wonderful. Okay. Now I think what we're going to do is, do we have another before and after case, or shall I move on to the gift card info?
Do one, but if you're under pressure, it's okay.
Let's do the one more. I just really want to see this. They're so good.
Okay. Well, this one we wanted to choose because it was melasma, actually. I mean, okay, we're not. Okay, we'll go with this one. It's okay. So this is typical BBL treatment. So this patient just wanted to come in and try and treat some of this redness. So this is her before and afters after about 4 to 5 BBL treatments for reducing redness. But look at the overall clarity of her skin. It's smooth. Her pore size is reduced. Yeah, it's like just completely healthy skin. And that was within a couple of months of doing these treatments.
Yeah, that has really brought down the redness.
Yeah.
Great. Well, absolutely love the before and after photos. Thank you, Suzanne. I think what we're going to do now is quickly tell everybody where to go for the gift card and the giveaway, and then we're going to take some questions. Let's see here. So I think there's going to be a graphic. Yes, there it is. 8west.ca/everythingskin. Go to this URL and put in your information, and we'll send you the information about how you redeem your $50 gift card for any of the services at the clinic here. And that's also how you enter the draw, and we'll be doing the draw for the $1,500 skincare treatment package very soon. I'll keep that up there while we continue talking. I want to do some questions here. So Catherine, who's been waiting so patiently, thank you. She says, I'm 51 and experiencing acne. Can laser help?
And yeah, of course. It really depends on what type of acne, and it's definitely more and more on the rise is adult acne, but it could be also hormonal acne. So yes, we have treatments like Forever Clear that we can reduce the acne P bacteria on the surface of the skin. We can reduce the inflammation in those pustules, and then the deeper laser can just stimulate some collagen underneath to kind of speed up that healing process. So, and that, along with maybe talking about home care, and we really want to get to the root of why you're getting this acne. And I think that's important. It's not just about treating the acne, it's about getting like into the nitty gritty of it, like and really trying to control the cause.
Yeah,
so
yeah, good answer.
Yeah,
good answer. And Catherine, your follow-up question was, I think it's hormonal, and I think that would be having a consultation to try to confirm and identify the root cause. It may be the skincare products that you at home, or it could be a treatment. But
yeah, definitely the skin gets way more sensitive whenever it's hormonal. Yeah,
so true. You're welcome, Catherine. Okay, so Bella, hold on. Somebody asked about sensitive skin. I lost that question. Okay, so I'll move on to one that I can see, and I apologize. One of our viewers is asking, do you get lighter or whiter? Do we lose the natural color of our skin when we do laser?
So it's a really good question. I think in that photo that we showed, it was a different lighting. So don't worry, people aren't just no pigment whatsoever. We wouldn't do a treatment. It's actually called hypopigmentation, and that's not what we want. We do treatments. When you see that halo glow, it's actually about lifting up that deeper pigmentation, and pigmentation actually absorbs light, so it's robbing your glow. So by lifting that deeper pigmentation and sun damage out, you're reclaiming that luminosity. When we do the deeper resurfacing, that is not our goal. We do not want to create demarcation or hypopigmentation. So that's why the consultation is so important. And if we think there's going to be any risk, we don't do the treatment.
Okay, great. And thank you, Bella, who popped up her question again so I can see it. Bella said, but Bella is a huge fan of Suzanne, and Bella, we're a huge fan of you. Yeah, Suzanne's been treating her skin for 3 years, and thank you for always supporting us, Bella. So her question is, which treatment is good for sensitive skin and for redness and also for hormonal skin?
Yeah, so well, myself and Bella have spoken about this, but definitely, while our bodies are recovering from, changes in hormones, it's very hard to control. We really have to choose products that are going to reduce inflammation and provide hydration to the skin, but it's going to be very temperamental. So we really have to just kind of, keep on top of how things are going. It can change from month to month. We have an amazing chemical peel, hydrofacials in the clinic. But really, that's really all we want to do at this point. We kind of just wanted to get it to calm down a bit before we go in with any stimulating lasers. A BBL treatment is also amazing for kind of calming down hormonal breakouts.
Great. Fantastic. So please go to 8west.ca/everythingskin to learn how to receive your $50 gift card and also to enter to win the $1,500 skincare treatment package. Christine, we can't wait for your treatment as well. We'll look forward to seeing you soon. Thank you to everybody that joined. Thank you, Suzanne. An absolute wealth of information.
Yeah, thank you so much. Okay.
Thank you.
Bye. Bye.
There's our Instagram info. Bye-bye.
Bye.